But if anybody deserves a huge MOPC standing ovation, it's Chris right here.
Teeters.
So I'm going to make him wait.
Wow. Thank you all so much. Well, I'm going to put the guitar down and we're going to talk about some clinical stuff. How about that? Let's go. I'm ready to bond. What? Oh my gosh. That shows up in my dreams sometime. You ever get that? Hey, we're ready to bond. Wait, what? I was on the beach somewhere. Awesome. Well, I'm super excited to talk about a bunch of areas that I'm passionate about, mandibular advancement and some clear aligner techniques with elastics, specifically the angel button, which is amazing. And then at the end, we're going to go into some practice growth pearls, which are 5 of my greatest practice growth pearls. So we're all about pearls. This is going to come at you fast. Get your notes ready because I don't spend a lot of time on each slide. We're going to be moving. So let's talk about mandibular advancement. So when I first joined the practice with my lovely wife's my father-in-law, Larry Davis, he was huge on this thing called the twin block. And I remember learning about it in residency, but everybody was about the Herbst and the Mara and all that. But he's like, trust me, this is the best thing ever. So for 12 years, I used the twin block, and this was a case that I treated with it. This patient was pretty much around when I first started. He had a 20 millimeter overjet. You could fit your fist between his top and bottom jaw. We show this case all the time. And we told the parents that this was going to be a surgical case. There's no way around it. We're going to use the twin block to try to reduce the amount, perhaps, of surgery that he may need. But ultimately, it's going to be a jaw surgery case. But he wore the twin block so well. And I just want to show you the concept of how the twin block works. Even though we've learned this, it's a good review. We have, our top piece and our bottom piece. And the expansion can happen on the upper as well. As the patient bites, the blocks help position the jaw forward. It can help us with deep bite correction as well, as by taking away those pads over time, it helps to open the bite. We all know how this works. It's always fun to show, though. And then so as we take the pads away, we know that teeth will erupt until they touch something. So as we do that, that helps open the bite in the front. And then the twin block comes out after about a year. And then we go into our second part, which is typically braces or aligners to straighten the teeth, finish leveling the curve of spee, and then we can get, a nice change. But this does have to be in a growing patient. You want to catch that growth spurt to get the best effect. So going back to our patient, he wore this twin block incredibly well, and we finished him here with no surgery. This is all braces and twin block. And then the question is, well, that's great. You can posture his jaw forward, but it's just going to relapse, right? Well, we had him come back 5 years later. Well, first I want to show you the change. You can see just the change in his profile. You can see the before from the front view, our left buccal, and our right buccal. And then here he is 5 years later. Maybe a millimeter relapse on that lower left-hand side if I'm picky, but a pretty amazing result. And this is just one of many, many cases I treated with the twin block. Here's another case that we treated, and this is a full Brody bite on that right-hand side. We know how notorious it is to correct this type of a bite. He's got full super eruption on that right-hand side. You can see from the CBCT view, we're also in a full step class 2 molar relationship. You can see from this view, we've got a full buccal crossbite. So what do? Braces is incredibly difficult. You have to put buildups on one side. You can't really get one on the other side. It's, it's just really, really hard to treat. So what we did with him, looking at this particular case, is we used a twin block and we expanded the lower arch. You can see that he has a V-shaped arch on the lower. And so if we expand that dentally, by disarticulating the bite with the twin blocks, we can get nice expansion in the lower and correct this Brody bite. And we were able to correct this very successfully without putting big buildups and having an asymmetric bite. So we know the twin block works. We know it's great. Been using it forever. We've got our phase 1 part, which is that year of mandibular advancement. And then we go into our braces or aligner phase. But there's a lot of things that aren't great about the twin block. It's uncomfortable. It's unaesthetic. It's inconvenient. And you have 2 separate phases. But I really didn't like the herps either because I didn't want all these weekend emergencies, and patients and parents were freaked out about that piston in their mouth. So I still would go back to the twin block and I just threatened to glue it in for a week if they don't wear it, and it got me through, right? But what if there's something better? What if we can combine the twin block efficiency with clear aligners? And so when A6 came out, I was really wanting to try this. You basically have your aligners with the blocks built in, but there's not a big bulky palette. It's aesthetic, it's comfortable, and it works great. So same idea. The benefit is now we've removed those 4 limitations of the twin block. It's now comfortable, it's aesthetic, it's convenient, and it's efficient. Also, when we talk about efficiency of correction, McNamara had a study, and it was one of my favorite studies when I first was a resident and published in the AJODO, randomized controlled clinical meta trials, that if you took fixed class 2 correctors and you took removable class 2 correctors, that on average is about 2.2 millimeters greater correction with removable. But our limit with removable, of course, is compliance, right? So you got to make it comfortable. Those big twin blocks, we were pretty good at convincing patients to wear it, but we had a lot where we did have to glue it in or had to just go into braces and accept a compromise. But if you can make it super comfortable, you're going to win. So how do we create a constructed bite? And this is the biggest question I get. Like, hey, I want to try A6. It's great. I love the concept. But how do I do this, right? So what you'll teach your team to do is to create a constructed bite. You're going to scan the upper arch, you scan the lower arch, and then it'll ask for a constructed bite. That's where you posture the lower jaw forward, you center the midlines. You want to make sure that your vertical opening is about 4 to 6 millimeters because you want to extrude the posterior teeth. That's going to help open your bite, level the curvus B. You want to make sure to overcorrect. You're going to get some relapse, so you want to shoot to an edge-to-edge or slightly class 3 correction. So I shoot for about 2 to 3 millimeters of overcorrection, and you want a little bit of opening in the anterior as well. It's very important to have retention attachments in the posterior. The biggest thing with using those mechanics of A6 and those blocks is you don't want that twin block falling out while the patient's wearing it. I'm an advocate of getting the most correction I can. When do we function the most? When we're eating. So I actually have them eat with this in. You can have a different thought on that. If they're functioning a lot with that lower jaw, I have them eat with it. They're changing aligners every week. It doesn't matter if they flatten them over time. You have more aligners that you're going to change into. If the patient's a strong bruxer, I recommend you can even fill those wells with some composite if you need some more resistance. But some cases we find that they're changing every 5-6 days because they tend to wear the blocks out. But they're moving into a new aligner. So it's not like a twin block. They break it. We got to talk about another lab fee. We got to send it in and wait 2-3 weeks. We just go to that next aligner. It's awesome. So retentive attachments are added automatically, but the idea is you want to be able to make sure the patient can keep the aligners in while they're functioning, while they're biting. And then I have beveled attachments on the incisors to help intrude the lower, help preliminarily level the curvus B. So we have our first phase. That's basically the twin block phase or the A6 phase where you have the blocks on. That's where you're focused on mandibular repositioning, preliminary leveling the curvus B, and getting some arch expansion by progressively expansive aligners. Phase 2, analogous to our braces phase, this is when the twin block part goes away. This is when the A6 wings go away and you're into traditional aligner therapy at this point. The nice thing is kids have already gone through the hardest part with getting used to having the aligners, and the compliance is great. We tell them, hey, you can switch to braces at the end if you want, but you've already committed to aligners. We can go right into aligners, and they all want to just finish with aligners. So it shows you patients, once they get used to aligners, they love it. So in phase 2, that's analogous to our braces phase. We're leveling the curvus B, we're continuing tooth alignment, and we're detailing the intercuspation and just correcting everything. What's nice about this too, though, is in that early phase, if you have a Div 2, what do we have to do with that traditional twin block where they're jetted out into a big class 3? And parents always call me saying, hey, their jaw's not in a good spot. And I go, no, trust me, we're going to move the upper incisors a year later. Don't worry, but she's a bulldog now, like fix it. With this, you can start actually protruding the upper teeth while you're advancing the jaw. So you can get some preliminary in those Div 2 cases that I used to have a harder time with. The nice thing is too, these blocks have these ridges. Patients go right into that proper bite. With the twin block, and my staff will tell you, like sometimes they're biting off to the left or the right, or we got to teach them how to bite. This time, every time, they're just going right into that, wherever your constructed bite is, they're biting right where they're supposed to bite. So it's really nice that these ridges just help bring that jaw forward and help them get into that right spot. I went to dental school at UNLV, and we saw this everywhere. There's a gas station and a casino called the Terrible Herfs, and it happens to be how I feel about the Herfs and many patients too. So if you can eliminate the piston and go with something that's removable, why not? So overcome those weekend emergencies, poor aesthetics, and starting patients away when you show them the piston by switching to A6. Give it a try. I've switched. I don't even do the twin block anymore. I'm just all A6. No more Herps, Mara, anything like that. So in summary, this is a great one to take a photo of, or if you're online, this will be sent out to you too. This is how you set it up. Get your bite construction, 4 millimeters of opening, 4 to 6, overcorrection by 2 to 3 millimeters. You want retentive attachments in the posterior and some beveled intrusive attachments on the lower anterior. Phase 1, we're focused on advancing the jaw, preliminary tooth movement, leveling the curvus B. Phase 2, analogous to our braces phase, that's where we're going into detailing the bite and getting everything ideal. If you want more information on this, my colleague, Dr. Isaac Yelazar, has a great talk on A6 as well that goes more into it. I also have an on-demand on there on the Angel site. You can watch it anytime that you want. Goes into more detail with A6. My second favorite, probably my absolute favorite thing about Angel Aligner is the Angel button. This was the winner at the second annual Orthodontic Awards of the greatest invention in orthodontics that year. And I think you're about to see why. What's really nice about these buttons is that they're integrated into the aligner. They're the only aligner system that has a true integrated button. What's nice about it is you can now place your elastics, your buttons for elastics in the interproximal. And why is that important? You can have a full-sized attachment on your canines now. It's not going to bother the tissue because you don't have that protrusion of the tooth and then the button. It's going to save you 10 minutes of chair time for every single patient. You don't have to worry about a button coming off that you have to rebond, and it's a lot more aesthetic. You can even place them on the lingual now. Interproximal, lingual, wherever you want them to go. And halfway through treatment, let's say you want to start with some class 2 traditional elastics, but later on you want a vertical component. You can say at stage 10, give me a lower button on the lower right 4, between lower right 4, lower right 3. You can change it. So you're not going to take the button off, polish it off, put on a new button, and then, oh, the button came off. Now we got to put in an emergency. This is the best thing that's come into aligners since I started doing aligners. It's absolutely incredible. So if you think about traditional elastics, right, we have the issue of edge warping. We have the issue of, especially with those cutouts where it's bothering the gingival tissue, greater risk of molar extrusion. The appliance won't fit as well, and you can't do certain things with a cutout that you can do with a button that you can place pretty much anywhere you want on the aligner. So here is our new system, integrated with the aligner, added digitally. It's incredible. Chair time, again, 0 minutes for the Angel button, 10 minutes for every button. It has a very ergonomic design. It's very smooth, doesn't irritate the tissue. And then here, once again, showing traditional elastics. You can see how the elastic's pulling away that protrusion on the aligner that irritates the tissue. You can see with the Angel button that it doesn't pull that away, so you're less likely to have a tissue irritation. You can also apply your elastics at 360 degrees around. You aren't limited. With that cutout, you can see you have just that narrow, obtuse angle of where you can actually place the elastics. You can place the elastics any configuration that you want because it's a button, not a cutout. The material is excellent. It's the same material that the aligners are made out of. You don't want a flexible material because it'll slip off. You don't want a brittle material because it's going to break. The master control material that the aligner is made out of, that also the Angel button's made out of, is both robust, has retention protection, and can distribute the anchorage. If we see this mapping, you can see the Angel button, all that force is concentrated around the button itself. With the traditional cutout, it's spread out around the aligner. You can see where the aligner has been deformed there. So let's talk about all the things you can do with an Angel button. I'm going to give you a bunch of examples we'll go through quickly. And these are just things that I've used with the Angel button. You can really do whatever you want with it. That's the beauty. But class 2 elastics, probably the most common application. But now you can move it to the interproximal. So you can have full-size retentive attachments. Very important pearl, I would put an attachment on your lower 7, because that way, as the elastics are wanting to lift the aligner, the button, the attachment, keeps the aligner on the tooth, so it does not lift. Really important to have a distal one. The Angel aligner techs know this. They'll usually put one on there, but just in case, I would have a nice attachment back there, okay? How about crossbite elastics? If you want to coordinate the arch width, this works really great if we want to get some maxillary expansion and lower constriction. And, we have a crossbite. If we're doing some initial expansion, you can put some angel buttons on the lingual of the upper aligner and then some buttons on the buccal of the lower aligner to help with expansion. If we want to constrict a single arch, you can run it just straight across the occlusal surface, have them use an intermaxillary elastic across. How about traction for a malposed tooth? It's nice we can keep an edentulous window, or we can use elastics to help bring the tooth into that space that you need. Adding a vertical component is great. I usually start with class 2 elastics just straight across, and then halfway through, I want some more vertical settling, especially if we have like an open bite tendency. You can say, again, that's stage 20, I want some a vertical component. Again, once again, placing the interproximal, you can see there between the 3 and the 4. Vertical elastics are important, especially at the end, as we know one of the challenges is getting that nice occlusion when we're done and trying to force settle the bite. It's a lot of times at the end, I'll do some angel buttons in the posterior to just get some force settling. So when they take the aligners out, there isn't that posterior open bite. Yes, most of the time it will settle, but if patients are bothered by it in your refinement, you can ask for that as well. How about an impacted tooth? What do we do with braces? We work up into a stainless steel wire, pit all of the teeth against that one impacted tooth. Same idea with aligners, but now you just snap it on and you're pitting basically the force of all of those teeth against that impacted tooth. Put some angel buttons on the adjacent teeth and help bring in that impacted tooth. How about if we want to use it with TADs? That's fantastic as well. You can do TADs in the posterior and help retract. Correction of stubborn rotations. A lot of times it's really hard to grab onto that plastic for a rotation, so it's nice to put some temporary angel buttons for the first few stages to help with that rotated tooth. We want to create a moment, so I have one on the buccal surface of the tooth and the one behind it and then the one in front of it, or depending on how it's spun. You want to create a moment, so you have one on the lingual surface, two on the lingual surface, two on the buccal surface. Help create that moment to rotate the tooth. Anterior box elastics for those open bite. We know aligners are amazing at correcting open bites, but it can really help in the end to wear some anterior vertical box elastics to help extrude those teeth. Midline correction, really nice to be able to run those midline diagonal cross elastics to get those midlines centered toward the end. The bootstrap's really nice. We all have dealt with stubborn lateral incisors that aren't tracking. If we're seeing that happen, again, on that refinement, you can do these bootstrap elastics where you'll put an angel button on the aligner, and then you'll have a traditional button on the tooth to help lock in that tooth. How about with leveling gummy smiles? We've done a lot of cases where we've placed TADs, about 4 of them, to help intrude the maxilla and then help auto rotation of the mandible. Now that can be done with aligners and angel buttons, which is awesome. How about class 3 elastics? Of course, that's another configuration we'll commonly use. You can run it to a face mask in younger patients, usually before that suture's fused. Before the age of 10 is usually when I like to do that, but can now all be done with aligners in early stages. Another huge thing is with no other system that I know of, can you run buttons at an edentulous region if you're missing a tooth? Also, what about on top of an amalgam restoration or on top of a stainless steel crown for a patient? You can put a button there now. You don't have to worry about that. So here's 14 applications. This is, again, a great summary slide to take a photo of ways that you can use the angel button. But again, it's really up to your thought and what you want to do with your mechanics. So essentially, this is how easy it is. You go into the software. Let's see if it'll play for me here. So you push a button, you click on the little angel button in the software. Oh, thank you. Thanks for playing that for me. Appreciate that. Yep, so you click on it, all these little blue circles are where you can place an angel button. You just drag and drop. It's easy as that. So the button goes where your thought goes. You can change configuration any point in your iOrtho plan. No extra chair time, no more bond failures, no discomfort from the protruding buttons, no more anesthetic buttons or metal buttons, no more limitation on button placements, and a lot less hassle. All right. So this happens to be a patient whose wife is going to dental school. And so I thought this would be perfect because he comes to me saying, well, I saw a bunch of orthodontists and they said, well, you can't fix this crossbite with aligners. You might not even be able to do it with braces. You need jaw surgery. I said, well, let's give angel buttons a try. And you can see our setup here. We did some IPR on the lower. Let's see, it should play now. Let's see. So I have some IPR on the lower because I want to constrict that lower arch and also help bring that midline over. You can see we're to kind of segmentally bring the teeth over. And then you'll see on the lingual surface where I placed the angel buttons. I have a class 3 elastic on the right-hand side to help with that, moving that midline over. See, there we go. And then we have 2 on the lingual surface of the upper. And so, yeah, it worked out great. I'll show you those post ones because we're just finishing now. But again, a lot of things you can do with it. So as promised, I'll go over 5 of my favorite practice pearls. These are really helpful to take home and apply to your practice. First one is branding galore. Big fan of Alibaba, especially if you're doing a rebrand. You can get a lot of things very inexpensively. We redid our pens. We did some swag bags. That lit sign that you see up there, $500. Couldn't believe it. I was going to be about 20 grand to do it in the States, and I had them create it, had my electrician install it. Everyone takes photos with it. It's awesome. These cards actually have a gold shimmer on it. They're gold stamped. Gold and black are our colors, and I wanted it to really stand out. And so it was really nice to be able to have that. With that, I recommend getting your own branded aligner kits. You are branding your office, not necessarily a particular aligner company. The angel cases are awesome, by the way, and so we still give those out. Now, Rebecca really likes them. She's like, I think I'm going to give them these because I just love it so much. And so that's good too. But it's not, then you could say you could have one at home and then one on the road, but it's nice to brand your own office. So our retainer cases, our aligner cases are branded with our logo. We want that in front of them as much as possible. Some other things, again, that I got on Alibaba to get these tumblers in the States would be probably 20, 30 a piece. These are about 4 to 5 a piece. They look just like a Stanley. This has a gold foil stamp on it. So when patients start, we give them call it the Teeters trio. They get the tumbler, they get a t-shirt that we brand with a logo, and then of course the treatment. And that's my beautiful wife there. But again, that's really important to really brand their behinds and really just as much as you can. So every little baby that comes in, we ask if they want to, we ask the patient's parent if they want a onesie, and they're always like thrilled because you can never have enough of those. And you're basically branding their behind. So when they're 7, they're going to come see you because they got, your logo on there. So it's a really highlighted day to walk up to a baby and just like hand it to the mom and, oh, it's so thoughtful. So, think about doing those things. Huge thing too with Angel, you can use any scanner you want. Voxel's here tonight. I've talked to a lot of my friends who have switched to the Allied Star. It's like half the price of a lot of the leading ones. You don't have the disposable sleeves that can get expensive. It's portable, it's light, you can plug it into all your stations. It's open source, so you can use it with any lab that you want. Angel now has direct integration. They have a lab pretty much in every state that will directly send it to Angel, so you don't have to export and send it out. It just automatically uploads for you. Because I saw this from Neil Kravitz, he posted it in our forum recently, and I just had to laugh a little bit about how everyone feels about getting that new scanner, right? It's like those that get the iPhone, right? The iPhone 16 and 17 are pretty much the same, but we're smiling because we got a new scanner. But if you're not forced to upgrade, why? If it works fine, right? So it's really nice that the Allied Star is open source. NFC cards, these are really great. I get this at mymetalcard.com, and then I generate a QR code from qrcodegenerator.com. And this allows patients, or allows your referring dentist to tap to a patient's phone. It takes you directly to our Ortho2 scheduling website, and then they can book an appointment. So this is really nice for newer docs. They're metal cards. They're absolutely beautiful. They have like a gold foil stamp on them. I think they came out to a few bucks a piece, but I give them to all my referring dentists and all the hygienists and all the staff members, and they just tap, tap, tap. So that's really nice. Another one is Kids Club. It's my beautiful daughter Ava here. She's just representing our lanyard. This is something that I got from Tony Panice. So his course is highly recommended. Very good. He's got a Master Marketing Academy. This one I got from, I went to the TC Intensive, and they had, just, it was a breakfast with Tony event, and they just gave a bunch of pearls. And this one I just kind of grabbed and ran with it. But you can create these pins, and these pins are really nice. You can create them basically of whatever you want, but I just searched up some general artwork, and I had someone on Alibaba create the pins. But patients, when they come in at 7, a lot of times you're not starting them till 10, but you want to make sure they're excited to keep seeing your practice. So we have these lanyards that we made. I can give you the source if you reach out to me. I'm happy to share that. But we have it with our logo and a little kids club card that has their picture and all the pins that they can win. Our practice is about more than straight teeth. It's about reaching them and helping kids develop as a whole. So if they come back and they donated to their community or church, then they get the donate pin. If they show kindness to someone in need, they get the kindness pin. Reading a book, the one that parents love is cook a meal for mom and dad. They're like, oh, that's the next one they're going to get. So I have so many patients that come in and they just want to get their next pin. And if they want to continue once they've started treatment, absolutely. Every time you come in, if you've done one of these things, especially if you post it on social media and show us, you get the next pin. And so we have kids that come in, they've got all 12 pins, and they're just excited. So, and then they get to win a big prize. And that's, another piece of branded swag. It could be one of those tumblers. It could be something else that you brand with your logo on it. But you want to make sure the reward is also something branded. Okay. Probably our biggest pearl, as Michelle and Dino alluded to, was bringing an emotional support animal. I went to go visit Brad Chavatal, and he runs his own Checkmate Consulting company. But when I visited him, the biggest takeaway was he had this dog, Ray, that just ran in and walked up to every patient, and they all just absolutely loved him. And, we have a golden doodle that's 10, and then her younger sister, Coco, that's in official training now. But ever since we brought her to the office, all of our social media posts from our patients, it's not their kid, it's the dog. It's Ginger. She walks up, gives him a kiss. She's been such a hit. Occasionally you have like the one-off parent that doesn't want the dog there. And do you even want to see that family, honestly? Right? Yeah, I like that. But, if they do, we just move them over to the pedo side or have a little designated area for Ginger. So, we love doodles. They don't shed. Brad's dog sheds. They didn't even care. Like, just, bring your dog. Like, it's fine. It's just the best thing ever. So patients love the dog so much, we decided and came up with this branded dog that they can earn with braces. Our Paws for a Cause. And this is speaks to our bigger picture. Patients can adopt a puppy for $25. They can get a puppy and a t-shirt for $50, or a puppy, a t-shirt, and a tumbler for $100. But all that money goes into a pot that basically goes toward free treatment for a kid in need in the community. We give it to our referring dentist. So we want our referring dentist to recommend someone that could really benefit from it. So it's not us deciding. But typically they'll say, hey, I have this family that, they really can't afford it, but the kid's got this underbite. Can you help them out? Absolutely. So the money we raise goes toward basically taking care of the swag and all of that. And we just decide that we want to do a bunch of pro bono cases a year. But patients know that as they're donating to this program, that it goes to support a great cause. And it's been a real feel-good thing in our community. And again, just reinforces the love of dogs. And I got this idea originally from a lot of my friends that have done this. Dr. Grant Collins has his sharks for cancer. And then we have Dr. Kyle Fagala. He has his sloth. And then Colt Johnson has his unicorn. So, think of a mascot and then, have a program that you believe in. For Dr. Collins, it's for raising, for cancer patients, pediatric cancer patients. And then for Kyle, it's patients in the community, Embrace Memphis. And then for Cole, it's for foster kids. So if you have something you're passionate about, tie it into the big picture. So last thing I'll leave you with, I always like to leave with some life pearls. For those who listen to the Orthodontic Pearls podcast, we appreciate so much of your support for listening to this. It's been just a great way, free podcast, but we get, big orthodontists on there and people outside. We recently had Jim Dahlia, the white coat investor, on there. And one of the takeaways was, in residents and those who are new grads, first 2 to 5 years, you're in the live like a resident phase. You should not just go crazy and buy that car, right? You need to get out of debt. You need to work for your future. And that's very, very important. You want to reward yourself a little bit. So they say, bump up maybe 50% of your lifestyle, but don't go crazy. Now, for the rest of us that are past the 5 years, then you start to get into that second stage of your practice or that later stage of your practice. We get really, really good at saving and really bad at spending, right? Like we're thinking we're going to, may run out or it comes to a day. So the other part we talked about on this podcast with Jim was the idea of die with zero. If anyone hasn't read that book, I highly, highly recommend it. Yes, love it. Yeah, and the idea is that most of us are so afraid to run out that we're not using money at the best stage of our lives, which is now when your health is the best. So And it talks even about like passing down inheritance. Like we wait till we pass, and then how much your kid's going to need that at 60, right? When can you move the needle for them? 2025. They need a house. They need to start their practice. So the idea is like be smart, of course, but you also want to live and realize that, life is short and you're not going to be able to do the same things at 80 that you are now. And so the takeaway with that is, go on the trip, come to the conference, and of course, buy the rock concert tickets, right? Go see your favorite act. So thank you all for coming to Relapse. That was super awesome. So takeaway with that is to definitely make the most of your life and invest in the memories, because later on, when you have more funds but less time and less ability to do things, you're going to be living on those memories. You're going to be looking back at the photos from last night and all the things that you've done. And so, last thing I'll, remind you on that is I'll kind of skip over there. We just don't have a whole ton of time, but we would love to see you at the 8th annual Mother of Pearls conference, where we'll continue these memories, continue the learning. And I told my kids I wouldn't, they don't want me to do this, but I'm going to say, you can't forget the dates, because everyone as a kid in here knows about 6'7", right? I don't know what it means, but that's just the new thing. If some basketball player's height, I don't know, but anyway, we'd love you to scan and come join us. So, yep, I'm available to help. Feel free to save my information. You can reach me by phone, by text, email, Facebook. I'm in the group. And yeah, look forward to enjoying the rest of the conference with you. So we're going to pass it back to Dino and Michelle. Thank you so much.